and welcome to this introductory video on the pain management programme. My name's Lindsay Jackson and I'm the clinical psychologist in the team.
My name's Catherine Sharples and I'm a clinical specialist physiotherapist within the team.
Thank you for watching today. I imagine that the reason for clicking on this video is that you've attended one of our assessment sessions with one of the doctors in the team, and it may have been suggested to you that a pain management programme would be the best course of treatment for you at this time. So this video is really a chance for you to get to hear about the pain management programme so that you can make a more informed decision about whether this programme is the right thing for you at this time in your life.
The pain management programme is an interactive group-based programme, and it is an 8-week programme that runs on a weekly basis of 3-hour sessions. So the programme is led by a range of specialists within pain management. We don't expect you to sit for 3 hours just watching presentations or not moving or being afraid to move. We actively encourage that if you need to get up, stretch, move at any point within the programme that you can. You can take breaks at any point during the programme. We have scheduled breaks as well, where you can grab a coffee and decompress and come back.
So what do we cover on the programme? We'll cover medication, we'll think about skills for managing difficult thoughts, difficult emotions, difficult physical sensations that arise. We'll also cover some mindful movement as part of the programme. And the overarching therapeutic approach within our pain management programme is evidence-based, and that is a type of therapy called acceptance and commitment therapy, which really translate to accept where you are in your current pain journey, choosing what skills and actions to make, and then making a committed action to make changes. There is a part of living with persistent pain in that it really impacts on our thoughts and our emotions and our physical sensations. And so a part of the programme is really getting in touch with our bodies and really understanding how our minds and emotions work in terms of persistent pain. And so a part of the programme really will look at skills and tools to manage some of those difficult thoughts and feelings and sensations as they arise. Really, the aim of the programme is to learn and understand why and how pain persists. And quite often we'll be thinking about learning about why it hangs around for longer than we're expecting it to, thinking about building skills and goals, and considering how you might make change. Now, the aim ultimately is to improve your life, living with persistent pain, because we understand that pain is a really challenging part of everyday life that can impact on your relationships with other people, impacts on the choices that you make and the activities that you do, and that can be really challenging. We tend to not focus on symptom discussion per se in the sessions, unless it is understanding how pain impacts on you specifically in order to move forward with your life. So at the beginning of the programme, we would have a one-to-one session with yourself to understand what your hopes and aims and fears are for attending the programme and any particular goals that you have that are personal to you. We would then review those again at the end of the 8 weeks to look back on the 8 weeks to think about how your ideas have changed and whether any skills and things that you've put in place have been useful to you, and then think about planning a 3-month goal at that point, because we have another session 3 months following the programme where we come back together to see how you've embedded the skills and knowledge that you've learned through the sessions. And so how do you know if the programme is right for you at this time? Usually the group-based programme works best for people who are not looking for tests, medical interventions or surgery, but we also have an expectation that you will commit to attending every week, because each week will be a new topic and it will build on the week before. And so if you miss a week, you will lose quite a bit of information, which may make some of the other sessions more difficult. We also have an expectation that you are willing and open to trying new skills and ways of doing things, because each week we will be setting some personal goals based on the information that we've shared during the session. And there is a commitment for you to try those each week to test out whether that would work for you, and there is a little bit of trial and error within that in terms of what works and what doesn't work, and so we ask you to be a bit playful with those things. So really, if you're at a space where you feel ready, willing and able to learn new ideas, practice new skills and try something different, then this course may be good for you at this time.
So if you would like to enrol in the programme, then please click the yes button underneath this video. If this is not the right time for you, or you do not wish to participate in the programme, please click the no button under the video below. If you are currently engaged in active treatments within the service, then those will continue. However, if you do not have active treatments planned within the service at this time and you choose not to engage in the pain management programme, then at this point we will discharge you from the service and back to the support and management of your GP.
Thank you for watching, and we really hope to see you on the pain management programme. If after watching this video you're still a little bit unsure and you wanted to have a discussion with a team member, then please do give the telephone number a ring and one of the team members can get back to you and talk you through it in a little bit more detail.
Thanks for watching. Take care.
Bye bye.